What testing do you like to do? Do you like to do stool testing, breath testing? Do you do it all? Which test do you like to do in your particular practice?
Well, we do practice what I like to call personalized medicine. So we really do, every patient is different. So when I say that, I know it sounds a little cliche, but it is really, every patient is different. So in some patients we'll do, there's a lab nearby that does PCR testing. PCR is where they test for a unique DNA sequence to a particular bug. And so there's several labs that will do that. So if I really think there's an infectious cause that's contributing to the patient's symptoms, I'm going to look for that infectious cause. There are several labs. MDL does a pretty short number of bugs, common things that you might run into frequently: Enterococcus, E. coli, H. pylori, several parasites, and a couple of viruses, enterovirus and adenovirus, and then and a couple of yeast. And so that makes it a simple, short, sort of the most common, hitting the high points. There are a couple of labs that do much more extensive testing of PCR, like Dr. Fry out, I think he's in Arizona, I'm sorry, I forget exactly where he is, does something like 40,000 bugs that he tests for in his PCR test. And then also Periomics is a similar company that tests for thousands and thousands of bugs, very unusual bugs, things you might not see elsewhere. And so if you really think you have an unusual bug, we had a gal who had heart valve replacement, and her hospital actually sent them out a notification saying that they had this unusual Mycoplasma chimera that was common to infest these cooling systems that they use during open heart surgery, and they were concerned that she may have been exposed to this bug. And so we actually were able to find it using that Periomics testing.